Groom Untold Truth About Bariatric Bypass Surgery.
Of me. Hi, I'm Tara. So today is a get ready with me, but I also want to label this video the untold truth about bariatric surgery. Things that I'm coming to grasp with, things that were mentioned, some that weren't, some that were, and not so much the severity of what you go through. So come with me as I put on my makeup and talk about it. So the first thing I want to mention to everyone that is not aware about gastric bypass surgery is how much changes your body goes through as far as the severity of the surgery. I am approximately about 12 weeks post-op gastric bypass surgery. I had surgery on September the 16th of this year, and I've lost about around 45 pounds so far since my surgery. I'm not losing it significantly fast, but I'm not losing it significantly slow. I am what they call right on point, right on target of what I need to be. But I think my surgeon mentioned to me briefly that there is a potential stage that you go through while you are losing weight where you will develop rashes. I've talked briefly about rashes, what I've sustained thus far with developing rashes since I've had my surgery. So since my surgery, I have developed at least 2 rashes. I had one that was visible on my neck, what I associated with taking this medication that is supposed to help save my gallbladder. And I'm supposed to take this medication for 6 months, unfortunately. 3 to 6 months, max 6 months. 9 times out of 10, the 6 months. And I noticed that I was developing a rash in and around my neck area. I suffered with that rash for about a month, was doing little topical things to treat it, to help it subside or to go away, and we're good. And then all of a sudden, probably about 2 weeks ago, I developed a rash in my groin area on both sides of my inner thighs. And of course, with me losing weight the way I have lost it, I can see that it is contribute to the amount of fat of skin I had that's in between my thigh area. Okay, so disclaimer: if it's considered TMI, it's TMI. This part of it is not geared towards children. So if you have them, please, or if you're a kid, please stroll up. This part of the conversation is not for you. So I noticed it, didn't really pay much significant attention to it in the beginning. Just went on with my everyday routine, was putting like Neurosporin on it, thinking that it would help, it would subside for a little bit, but then I really wasn't getting much relief from it. So I went into my checkup that I had with the nurse practitioner who is part of the surgical team at the doctor's office that did my surgery. And by the way, this is LA color palette that I'm using. Eyeliner was LA eyeliner color black. That's what I'm currently using right now today. And this is just a basic eyeshadow brush that I had gotten some years ago from what was it called? Barely There Makeup. And I just kept it clean and kept it up for those amount of years. So that's what I'm using currently right now as some eyeshadow. And as you can see, I'm just filling it in. I like to do this from time to time. I'll mix up colors and make it look like almost between an ombre effect and camouflage. Okay. And then you'll see why I'm putting the black on in a minute. It's gonna all blend in. I'm not gonna look like a clown, I promise. But anyway, I went, asked for some cream or something, or had them look at it, and they said yes, that's exactly what it is. It's from your fats of your thighs rubbing together. It is giving you a rash. So I've been dealing with that for the last 2.5 weeks. It's not comfortable. It's very, very, very itchy, especially at night. And so I have cream that I put on it throughout the day to help it subside. Hopefully, and I apologize in advance, I can tell you probably can hear it again in the background. I'm filming in the bathroom because I do have the best lighting in here, and also this is where I'm doing my makeup at today. So as you can see, it looks really good. You may hear them. I told you that unfortunately where I'm at, people are not very neighborly with respecting other people that might be staying here as well. So you may hear them from time to time in the background in my videos. So I apologize in advance for that. Yes, I have made a complaint because at the same time, I would love people to respect my privacy as I respect theirs. It doesn't always happen. This is the NYX lip gloss color 21. Had for a while. Like I said, I really need to stop on my makeup. Bad. And I should have did it within the last couple of days because there's sales going on as far as Black Friday and stuff. Cyber Monday. So I'll look and see what I can find. And this is the Fat Lip Oil by NYX. I'll tell you the color if I can see it still in a minute. I don't think there's one on here. Nope. It kind of rubbed off. But anyhow, this is how I'm looking. But yeah, those are some of the setbacks of having gastric bypass surgery is skin rashes and trying to get them to clear up. And especially if it's in a discrete area where you don't want it to be, or it's not clearing up as fast as I like. So I've been putting, I'll show you what the doctor advised me to use. Some talcum powder to dry it out. And I'll show you the cream which was given. And also just keep in mind they are documenting these rashes so that if I need to have a piniculectomy, I think that's what the surgery is called, for skin removal, that the insurance company would pay for it. But this is the ointment that was prescribed to me to use on that area, and that's what I've been using. Again, pretty quick video, nothing spontaneous, but as far as everything else, I'm adjusting fine. No complaints. I've been taking my vitamin supplements. I've been tracking my food as best as I can. I've been trying to make sure that I'm getting at least 2 to 3 protein drinks in a day to help also. Just keep in mind, if you are also a bariatric patient, also remember, if your doctor's already told you to, go ahead and make sure you are lifting weights, because a good majority of the weight loss that we are losing is muscle mass. So we need to replace that with muscles. And I've showed you so far mine, it's been in my arms here. You can kind of see where it's starting to protrude right here in my thighs. You can't see my thighs because they're covered up anyway, but those are areas that I'm having to work on right now. My stomach is pretty much the same. I don't know if I really will have to get a piniculectomy, whatever it's called, done, because when I had my daughter, the surgeon I had, or an OBGYN, he gave me a miniature tummy tuck years ago. So I may not even need one, but in case I do, all of the